Hello, my name is Jose Castillo, and I'm gonna be validating for tracheostomy care. The first thing we do is we verify the provider's order. The patient's record stated that that he needed he was ordered to get a suction, which we already provided, and also tracheostomy care. So we assess for the procedural need, and we can confirm that this patient needs the procedure, and we can go we can keep going with the procedure. Um, we walk into the patient's room, we perform hand hygiene, we wash our hands, we don gloves, we can introduce ourselves to the patient. We need to provide the patient with privacy, that's very important. And also, we need to identify the patient. So, what we're going to do is we're going to look at the patient's wrist. He's going to have a wristband. And we're going to read it, and we're going to ask the patient his date of birth and his name. We can also tell the patient that what we're going to do is tracheostomy care procedure. We're going to be cleaning his inner and outer cannulas. This is, again, a non-verbal procedure. We had stated in the procedure before, the suctioning, and we're going to repeat it again, that if the patient feels any kind of discomfort or any kind of pain, he would need to raise his right hand for us to understand that he's in pain. Also, I assess for the patient's vital signs, and his blood pressure is 120/80. His heart rate is at 75. His oxygen saturation is at 98%. He's breathing at 16 breaths per minute, and his lungs sound a lot better. There is no more that ronchi sound that we used to hear in the procedure we did before. This kind of procedure, as the procedure we did before, the patient has to be high up in the bed, so we have to put him in a semi-Fowler's or a Fowler's position. Also, we need to increase his oxygen prior and during the procedure, and also after the procedure. We had already discarded the fenestrated gauze. So what we're gonna do right now is we're gonna don sterile gloves. We can always grab them from the border. We can put them on. Just grab from the border. This one is already sterile, so it's easier if we need to fix it. This is the dominant hand, and we're gonna open the kit with it. The first thing we do is we take out this piece of gauze, and we're gonna pour all of the things in there. Once our kit is empty, with this hand, we're gonna place the normal saline in it. Now we need to pre-moisture the gauze. One of them, want to pre-moisture. The other ones are gonna be, we're gonna keep them dry. We're gonna remove the inner cannula by first unlocking it and pulling it out gently. This is what I'm gonna have to use as an inner cannula. I don't have anything that resembles it. We're gonna pretend that it ends right here. So this is my dirty hand. This is where I can actually touch the white part of it. Always keeping it by your side. The curvature has to be like you see it right here. and then we're gonna place it in the normal saline, in this part. Once we do that, we need to clean it with a brush, which we have here. We can put the brush into the kit also before. We can do it, we can put it here, so I can get the saline into it. And what we're gonna do is we're gonna clean it from the inside. And then we're gonna use another one. Sorry, and we're gonna clean it from the inside with the brush. We're gonna get rid of it. So in order to clean inside of it, we're gonna use one of these to dry it, and then we're gonna dry the other part. We're gonna make like a little knot, and we're gonna dry it like this. We're gonna dry it like this. We're gonna get rid of this. We always have to remember that this is the dirty hand. This is the dirty part because this is the outer cannula, and this is the inside. This is the only part that my glove can touch. Now that is there, we gotta secure the outer cannula by turning it to the lock position. Now we can insert it. So we gently go in it. We place it this way into the patient, so that it would look like here, like it was here. And then we secure it into the lock position. And then what we do is that we clean that area with the Q-tips. The down part, one Q-tip. And then the top part. So if this was here, the upper part with the other Q-tip. And then we would also clean with the gaze, upper, lower, and then we would dry it. Once we do that, we need to place the fenestrated gauze, the fenestrated gazing, which is this one, in there. Once it's there, we need to replace the ties. We have to keep the old ties. This is the ties. But we have to keep the old ties in until the new ones are secured and fastened. We cannot remove the old ties until the new ones are tied. After we do that, we can say that the procedure is done, that the inner cannula and the outer cannula are clean. The first thing we need to report is the date and time. So we're gonna say that this procedure was done at noon on September 23, 2020. The respiratory assessments before and after care are the same. There was no particular change in the patient. The stoma and the skin around the patient's cannula looked really good. It looked pink, red. Everything looked fine. And the vital signs, we reassessed the patient. We got vital signs and everything is exactly how it was before. So the procedure went well.